Welcome everybody to GoLocal Live. I'm Josh Fenton, CEO and co-founder. First, I'd like to thank Vanessa Voles from Sojourner House, who joined us a little earlier. If there's an organization that's doing proverbial God's work, that is one of them, trying to combat domestic abuse. If you've got an extra nickel, go to their website and make a donation for them, to them. It's good money going after a good cause. The rest of the schedule is we're going to have dueling lives today at 1 o'clock. We'll have Governor Gina Raimondo with the latest updates, and we'll also have Dennis DeJesus from Special Olympics. Let's go to Dr. Fine. Dr. Fine, how are we today?
I'm great. I hope you're good. Beautiful day.
Beautiful day. Let's go to first, and then we'll go to the numbers, but first let's go to Dr. Redfield. Dr. Robert Redfield had an interview with the Financial Times of London and put out some strong warnings, I think, to both government officials and to the public that if things don't change in how we are collecting data, conducting testing, we should expect a second lockdown in the fall. Your thoughts on his comments?
Well, I would add not just conducting testing, but getting people into isolation and preventing more transmission. That's the critical piece. You know, I can't predict the future. CDC sometimes over predicts disaster. And, you know, as we get closer, we'll have a better sense of things. You know, this is something that we can influence if everybody gets a flu shot in the fall. We got to get everybody getting a flu shot, and that will help at least take away the flu shot piece of this, or the influenza piece of this, you know, which every year is usually 30 or 40,000 deaths. A couple of years ago was 60,000. You know, if we have both together, a big flu year and a corona resurgence, we got a huge headache.
Yeah, because the flu on every second or third year fills up local hospitals to the boiling point, right?
Absolutely. And, you know, and flu peaks in February and March when, you know, COVID was really getting going. So we don't know much about the seasonality of COVID yet. My sense is that it will be closely correlated with daycares and schools opening. But we'll, you know, if we get them both together, we got a problem. And I think that's what he's really trying to get people moving about. You know, we each have a fairly significant role to play. And if everybody can just go get a flu shot, if everybody can just wear a mask, you know, if everybody can be thoughtful about disease transmission, then we can lick this thing together. And I think that's probably the subtext.
Dr. Fine, talk a little bit about this other CDC news that came out, which said, listen, maybe it's not so much a surface issue as it is an aerosolized transmission. That's kind of big news because for the last 10 weeks, we've heard a tremendous amount of information being provided by public health officials, both nationally and locally, that this is that a significant component of this is a surface issue. It lives, Dr. Scott, it lives for 6 days on a surface. Things need to be clean, they need to be wiped, et cetera, et cetera. That may not be as true, correct?
Well, I think it's probably true, but you got to walk on both feet. And the bulk of this transition from without having really good studies about it, the bulk probably is aerosolized. So I think what the subtext of that one is, you know, is yes, you can get it from a surface, but most transmission is aerosolized. So, you know, let's emphasize the aerosolized piece. As far as I'm concerned, in order to control it, you got to take care of everything. You got to do surfaces. You got to wear masks. You know, and you got to be conscious. You know, what I'm telling people on the phones every day is this is a disease that's spread by coughing, sneezing, breathing, and speaking. And once you realize that, coughing, sneezing, breathing, and speaking, that really influences, I think, what people choose to do. And that, to me, is the big message that says, wear a mask every time you're anywhere near anybody else.
I don't disagree with you on the science. I guess I'm raising the issue of the messaging. I've heard wash your hands, use hand sanitizers, wipe everything down with a Clorox-like product, et cetera, et cetera. I'm seeing less and less people wearing masks. If the issue is masks, that's where the emphasis should be. Maybe we ought to shift the emphasis in the narrative to emphasizing how critically important it is for people to wear masks when they're coming in contact with other people 10, 15, 20 feet apart.
Yeah, no, I'm totally with you on that. And if you look at what we're doing in Central Falls and Pawtucket, we've been on the mask thing, now for over a month. We have a major community outreach program around masks for that reason specifically.
Let's go to the numbers. Some disturbing numbers, and especially in the southern hemisphere, very disturbing numbers.
For sure. Around the world, let's start with over 2 million recovered. That's an important place to begin. Now more than 5 million people with the disease, 5.12 million people tested positive, probably 10 times that's the real number. Very painful day in terms of the number of new cases. We were at 120,000 new cases around the world, and unfortunately 330,000 deaths. We're still seeing 4,000 to 5,000 deaths a day, and that looks like it's going to get worse as the southern hemisphere gets hit. Brazil has had an approach something like ours, which is we're just going to pretend it's not there and hope it goes away. And then other nations that are populous where people live close together, I think we're going to see some pretty terrible numbers, and we're just at the beginning of those numbers, unfortunately. In the United States, we're at almost 1.6 million tested positive cases, still seeing 20 to 30 new cases a day, and still about 1,400 deaths over the last 24 hours, way too many. I think looking at the number of positive cases, those deaths are unfortunately going to increase. And unfortunately, we do not have Rhode Island numbers from the last 24 hours yet. We did get city numbers, and those city numbers show pretty much what we'd expect. Central Falls still being the city with the most tested positive cases as percent of population. But the growth in Central Falls, Pawtucket, and Providence, the growth in numbers is much reduced, and that, I think, is driving the reduction in the numbers around the state.
Yeah, those numbers can be seen on 7 major developments on the site today. We've listed the top 10 cities and towns across Rhode Island, both from a total number of cases and a number of cases per 100,000 population, i.e. a per capita standpoint. Was there any surprises in that new updated city and town data? I thought one thing was, it's not all the urban cities and towns, and it's not all low income, mostly, but
Smithfield. Smithfield is something. And North
Smithfield,
Providence.
yep, Smithfield, North Providence, I think Johnston, North Kingstown, those were all in the top 10. And a city like Warwick, I don't think made the top 10.
Yeah, remember, some of that is testing, and that's the problem. I'm not, we're not seeing, or I haven't looked at, they gave this to us a week ago. I haven't looked again, and I'll try to do that over the next 24 hours to look at the percentage of their populations that have been tested. So if Smithfield's getting tested way more than Warwick, that might account for part of the difference. I'll just look at that numbers and give you some feedback on that tomorrow.
I thought the governor was smart to talk about Memorial Day yesterday and urge people to still use best practices. I'm not sure she emphasized it enough. Now, yesterday was Wednesday. Hopefully today and tomorrow she'll push that message. But this is the kind of weekend, nice weather. It's going to feel like normal, a normal kind of world. And the disease hasn't changed at all. The disease is still here. What's the warning you want to pass along to folks about this weekend?
Well, again, just keep doing these things that make a difference. Um, you know, we're all going to get this disease, but the idea is to get it a mild case and to try to make it so that we don't all get it at once, which means to be careful and, mask and respect social distancing. You know, it is not very hard to do the things that are important to do. Um, the important thing is that everybody do them.
You mentioned to me before we came on, you downloaded the app. The governor first announced that 10% of the population had downloaded the app. It's actually 1% of the population has downloaded the app. What was your takeaway on the use of the app and the value of the app?
Well, it's a place to start like anything else. It really, as I see it, basically takes the information that's already on the Department of Health's website and puts it on an app. It's not super or magic. And it's one of the many little things that we can do to help make progress. And those are masking. And, the governor has a good idea about getting people to try to record all the 5 people they've been in contact with, or the people they've been in contact with. I'd love to see that on the app as a simple way to do it. There are a bunch of other things that one could add to the app, but, like masking, it's easy, it's not hard, what's the big deal? Like our 4 freedoms aren't going to stand or fall on whether we use the app or not, or whether we use the mask or not. These are things we can do together to try to get this thing under control.
Yeah, I mean, I would say the one major feedback that I think people object to is this, that the state can share it with their, quote, partners. I think that's a mistake. People understand that digital privacy is a major concern to people. I think there's always a reluctance when government's asking for data, maybe worse than if Dunkin' Donuts is asking for data. I think that privacy term should be changed, that the data can only be used by the state, and outline what those restrictions are. I think that would be a major improvement and make people feel a lot better about using the app, which ultimately you're trying to get people to use the app.
Yeah. No, you may well be right. But Josh, I had a very interesting discussion last night with my son, who spent some time in Sweden and who's been talking to friends in Sweden about how things are doing there. And what he was hearing really struck me, which is he was hearing from his young friends that the government said do this, the government said do that, and what people said was, yeah, we trust the government, so we're going to do what they say. What's the big deal?
Right.
Boy, look at how far we are from that place. And that's two-sided. One is because government doesn't always act the way it should, and the other is because we have become cynical and suspicious. And boy, it would be good to break through that and get to the point where there was that kind of trust back and forth again. Because at the end of the day, what this thing is doing to us is it's making us trust less.
Yeah.
And that's bad for the body politic at the end of the day.
Well, I think that's exactly the point. I mean, the government's got to understand the concerns of the public and bend over backwards. Saying I can share it with partners and not define that could mean any for-profit or not-for-profit or other governmental entity. The ACLU has obviously flagged the issue of law enforcement, which makes some people very nervous, especially folks in the minority community. I think government's got to be mindful of those concerns, and if you want to build trust, you build trust. Dr. Fine, as always, you get the last word.
Always a source of great delight. So the thing to know about this virus is that in a certain way it's like water. It seeks its own level. In a certain way it's like fire. It will consume all available material that's combustible. We got to keep that stuff in mind and keep our eyes on this ball, because this thing ain't going away just because we don't like it. Everybody needs to stay safe out there. And Josh, thank you for making all this happen so people know what's going on and can pay more attention to it.
Dr. Fine, thank you as always. 1 o'clock today, dueling Go Local Lives, Governor Gina Raimondo and Dennis DeJesus from Special Olympics, who obviously serves an incredibly important constituency in Rhode Island, and we ought to find out how we can help Special Olympics during this difficult period of time. Thanks everybody for tuning in. We'll see you back in a little while. Please stay safe.